Hi, everyone. It's Dr. Arlene Diamco, the MultiDimensional MD. For those of you that don't know me, I'm a pediatrician, an integrative physician, and a cranial osteopath, and I see people of all ages, from newborn to elderly. My mission is to help bring the intuitive aspects of health back to medicine in practical and tangible ways so that you can access deeper healing and experience more peace, love, and joy in your everyday lives. And today's episode is going to be a bit more vulnerable for me. It's called Signs from Spirit, My Story. So I'm going to be sharing pieces from my life and some behind the scenes of how I became the multidimensional MD. And I know there was many more of us out there, but how I came to have this podcast, how I came to practice the way that I do, and how I see life in medicine and the role of body, mind, and spirit, and all of that. So I'll be sharing perspectives from childhood, from my medical training, from other healers, things that they have told me, from family transitions, life transitions, so family deaths, and a literal call from spirit. It's it's a little bit different for me to be sharing in this way because it's deeply personal, and and it's not to convince anyone of anything that I've experienced, but to show you the beauty and the depth that life can be. Just from an example from my own life. And my hope is that by sharing, it will help other people see that depth and that multidimensionality of their own lives, because it helps us to feel more and to feel more connected and to live from the depths of our soul, our spirit. So I'll just start with growing up, and I see this in many patients that come to see me, many people that come to see me, because many of my patients are very sensitive and can pick up on all kinds of details naturally. And we all have our various gifts and ways we see the world, and we're meant to experience the world in different ways, but always through the lens of love and hope and kindness. Although it doesn't always feel like that. So growing up, I was, like many people, very sensitive. My senses tend to be more sensitive, and so I would feel things more empathically. I would feel other people's emotions, which was confusing for me because I didn't know always if I was sad or if I was feeling something else from someone else, and I couldn't always figure out like why I was feeling certain things. And not everyone would respond to the world in the same way that I did. And so that was confusing. And I see that confusion for many kids and adults that come to see me in my practice and the stories that they tell. But I learned to realize that there are certain things that I noticed that maybe weren't as easy for other people to notice. And this, not just in the ways things looked, but how they felt. So I could pick up on the feelings of others. And this can help you navigate life if you realize that the way you see things, feel things, hear things might be slightly different than other people. And so I would see this in adults as well, because I saw that. I wondered why the people weren't always kind. And that's really difficult as a child growing up. I mean, it's difficult as an adult to see people be mean to each other. And I wondered why they would do that. But of course, like as we grow up, then sometimes we do things that we ideally wouldn't want to do or behave in ways that we wouldn't want to behave. And so I start to see that as a compassion for myself and for other people, that sometimes you're not acting in your ideal and other people aren't acting in their ideal. And it gives you a way to understand yourself and others. And so it helped me with my navigation. It helped me to let go and forgive things more easily. Doesn't mean you forget, but to move on to love people anyway, even if they weren't acting in their best selves. And this includes like people that you're really close to. So your close inner circle and your loved one. You can imagine how that's difficult for people. And then I'm going to fast forward into my medical training. So, first year of medical school, and that was also confusing for me. My medical training was difficult for me, being more sensitive and being able to feel so many things. And when you're in the hospital, you will feel a lot of things. And in medical training, um, you're not really taught to address those feelings, those thoughts and emotions. Sometimes they would touch on it, but it would be so quick that you really didn't get to learn the depth of how to navigate difficult situations. And so in my medical training, I talk about this in my book in the very introduction of how I would see people going through difficult situations, and I felt like we were not equipped to help them navigate their own lives and their own health journeys with what we were being taught in medical school. We knew so much about the physical, but we didn't know how to integrate the mind, the spirit, and as human beings, we are always everything, body, mind, and spirit. We cannot separate it until you cross over. So until you transition, you die from the physical, then it starts to separate. But how do we help people be truly healthy if we can't see that integration of body, mind, and spirit? So that was another difficulty for me in medical training. And I decided early on that I was going to figure that out for myself. I was going to figure out how, as a physician, I would be able to address the multidimensionality of our being, because I saw that it wasn't being addressed in my training for early on as a medical student, and then even as a resident, and so forth. And the reason why this makes me emotional is because I lived through it and I saw people suffering, and then us as a medical profession not being able to address their needs, or not being able to address it within ourselves, and therefore not being able to help other people through it. So in that way, we weren't accessing all of what health was, and what the potential of what health could be, and what the medical community could help others through. And so um, then going through this, I mean, I had many transitions, and I talked about some of this in my book, and finding yoga and meditation, helping myself navigate through those sorts of things. So anyway, fast forward again, I'm finished with medical school and residency, and then I had to deal with, a transition of a loved one. So my grandmother's death. So I was really close to my grandmother. And at that point, I had just started to learn cranial osteopathy. So I could start to feel these rhythms in the body. At first, they seem subtle, but then as we train and get used to them, they don't feel subtle to me at all. But if you're not trained, or if it's something that you're not you don't naturally feel based on your constitution, then it feels like it's something really elusive and intangible. But when my grandmother died, and she was pronounced dead, she died at home. So a lot of family was there. I was there with her, and I had my hands on her. And so I was paying attention to her rhythms within her through this whole transition. And then when they pronounced her, because her heart had stopped beating and she was no longer conscious, and I can't remember exactly how that all happened, but my parents are physicians, and so one of them had pronounced her time of death. But I had my hands on her, and I noticed that her rhythms continued. So there was something still alive in her body, even though her physiology had expired, like her heart had stopped beating, but I could still feel something. So that was really fascinating to me. And it's hard to share these experiences in the moment as you're going through them, because I didn't know exactly what was going on. And so a lot of these things I kept to myself, because it's such a vulnerable moment for everybody. But I felt her rhythms continue. And that point in time, I could feel it probably to a certain extent. But what was interesting with my grandmother's transition is that it took about 20 minutes. So it was actually relatively quick. But after that point, my aunt said, and I don't know why she said this, and she doesn't even remember. Years later, I asked her. She said, now her soul has passed. Her soul has crossed over, something like that. And that was the same moment that I noticed that her body's subtle rhythms had stopped, or at least to my perception of them. And that was also really interesting to me because it was like, what was I feeling? And what was my aunt tending to? What did she feel when she said now her soul has crossed over as well? Because the time period, at least for that, and this is not say this is a time period for everybody, but for my grandmother and her crossing over was about 20, 22 minutes. And that was a time from the time of pronounced death, so medically, and then about 20, 22 minutes when her soul crossed over. And I thought the confirmation of my aunt saying something in her way. She wasn't a cranial osteopath, but she was just a very spiritual person and really in tune with that dimensional part of her. And then that matching up with what I felt as well. So then I was in practice for a number of years, and I didn't have my own practice yet. But when I moved to the Atlanta, Georgia area, then I opened up my own practice, and I knew there were certain things that I wanted to do. I knew that there were ways I would wanted to practice within integrative medicine and seeing things from a holistic perspective. And I just wanted to have the freedom to approach things in my way, in a safe way, still within the medical model, but to expand on these multidimensionalities of health so that we could experience more depth in our healing and our feeling and experiencing life. So, and then I met other people because at first I felt kind of alone in my journey. Like I was just experiencing these things on my own and not even sharing them with other people, not even knowing who to share them with. Like, who would I even say these stories to? And then, I mean, now I'm sharing them with you here, which is pretty amazing, which for me tells me how far I've come that I'm able to share more openly now. But over time, I did meet other healer types of people, and one of them is my good friend Maddie Fowler, who has the gift of clear hearing, and she can communicate with people that have passed on, so their souls even after they've crossed over. And one she had given me this consistent message of you're going to do something, you're going to be writing a book with your dad, and it's going to go around the world, and she said all these other big things I was going to be doing. And at that point in time, I mean, I was busy having babies. I was feeling like I'm just barely like able to like get through the day. I loved my work and everything, but the thought of asking me to do more when I felt like I was at capacity was something that felt foreign to me. And then one day when she visited, she said the same message again. And I said, "I'll do it." And she said, "Right there, that's the first time I've ever heard you say it in that way where I really meant it. I felt it in my whole being." I was like, "Okay, if this is the calling, I'll answer." And I said, "I'll do it." And and my friend Maxine, who's this Maxine Taylor, who's the first licensed astrologer in the United States, she also had delivered the same messages to me. And I remember this was when I was pregnant with my fourth, and again, I was feeling like I was just barely above water. This is around the same time that Maudie was giving me these messages, and she said, you're not doing enough. Your vision is not big enough." And I'm like, "What do you mean? I'm already helping all these people. I have all these beautiful children." I'm like, "What do you mean I'm not doing enough? And what do you mean my vision's not big enough?" And she's like, "You need to go long." She's like, your vision needs to be much bigger." And so anyway, those things after a while, after hearing them consistently for years, then I finally jumped in with 2 feet and I was like, "Okay, I'll do it." And so that was just before 2020. So maybe it was like 2018, 2019 period where I was like, "Okay, let me figure out." I said I'll do that, but I got to figure that out now. Like what steps am I supposed to take? And so one of the first steps was just getting more comfortable talking to people in public. So I was used to talking to people one-on-one, but I wasn't used to talking to people in a bigger groups or actually delivering messages for a group that I don't know necessarily where they're coming from. So to be able to talk and be comfortable with myself. And so I started to actively like develop like how do I talk to people? how do I talk, even like all of this, what I'm saying here, I wrote an outline, but I didn't write down exactly what I was going to say, and it's a personal experience, so I actually my hope was to be able to share authentically. And, so I started practice, and then 2020 was when I put together the podcast, The Multidimensional MD. But when I put it together, it was still hesitant. I said, I'll do this if it's sustainable for me. So first I have to do it for me. So I have to do it in a way that will help me grow. I will do it for me and then let that help other people as well. Because if 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 I kind of run myself down by doing this podcast, I knew it wouldn't be of service and it wouldn't support the long vision, the greater vision. And so this podcast was a great way for me to also practice being able to talk about all kinds of difficult subjects that were really important that I wanted to elevate the conversation for and to normalize them so that we could talk about them more freely in medicine, in our personal conversations, with the doctor-patient relationship, in all areas of our life, as we felt comfortable with. And so as we do this, it does help to become more comfortable in talking about bigger things, more difficult things, a grander perspective, it's like detailed perspective, and we start to weave those into our everyday living. And so as we're being this, then we're talking this, thinking it, and then talking it, then we start to put it into our actions as well. So this is the ripple effect of the inspiration for the podcast and the multidimensional MD. So I started that 2020. It was right before pandemic hit. I ironically, and yet like divine timing as well. And then it was a year later, 2021, when my dad died suddenly. And that is a whole other story in itself. One second, I just have to give my daughter a message here on live recording. Because she keeps buzzing in. But anyway, so when my dad died, that was a whole other learning experience for me because I had to learn how to communicate with him and through spirit in a completely different way. I'm going to take this call really quickly live. Hi, sweetheart. I'm on a recording right now. I'll be right back to you, okay? All right. Um, so anyway, this is all divine timing, and this all has to do with family and everything, like coming together like this. So it was after my dad had died that I really learned to communicate more and more with him through spirit, and I had been doing that with my grandmother, but we My I the words from Maudie started to echo back because she said that my dad and I were going to write a book together that would go around the world, and I I didn't know what that meant, and especially after he died, I was like, what do you mean by that?" And then I realized as soon as he died, like, what that meant was that we were going to be doing this together in spirit. And so I was and have been in constant communication with him through all of this. Um, and that's how I released the book, the I Am Intuitive, a multidimensional guide to embrace your inner light. This is the book here, which is available on my website, on All Worlds Health, allworldspress.com, or Amazon. And a lot of that was communicating with him, even line by line, paragraph by paragraph, chapter by chapter, like what to include, what to say, and getting those inklings of like, yes and no, and even more detailed guidance. And so, and like in my family, people have had so many different kinds of experiences where this is where when spirit starts to manifest into the physical and send signs through the physical, it's like it never stops, like, being mind-blowing or, like, incredible and miraculous. So after my dad died, then he was leaving feather trails for multiple people in the family. And sometimes people would say, like my cousin would say, like 100 yards away or 100 feet away or something like that. And she said, if it's really you, fly back to me and land on me. Or if it's really a sign from you. And this butterfly did. It turned around from however far you could barely see it, turned around, flew to her, and landed on her. So when spirit translates into a physical message, it is always amazing. And we never get tired of that. And so I'm going to share this story with you, and I don't know why I'm supposed to share this story, but I keep getting this urge. It's like an itch of like, you have to share this story. You have to share this story. Where I got a literal phone call from Spirit, and it was at my office, and my my office manager Daisy got the phone message on our voicemail, and the message went like this. And she said, well, originally she said, "Oh, your friend called, and said like, I I I just want to say that I'm proud of you and the work that you're doing." And I was like, "Well, who was it?" And she was like, "Oh, your friend Santa Clara." And I was like, I don't know anybody of that name. Like, this was a literal voicemail. And she said, and I was like, "Can you say it again? Because I don't understand." It's like, "Is this a marketing call? Is this what kind of call is this?" I was like, and she, of course, divine intervention. She had deleted the message, so I didn't get to hear the voice, but she said it was a male voice. And the message said, "Hi, Arlene. This is Santa Clara. I just want to tell you that I'm proud of you and the work that you're doing." That was it. There was no like call me back or anything. Well, I said, well, give me the number. And we had it because it was on our voice messages. So I called the number back, and it was the strangest thing because it wasn't, it didn't give an error message like a non-functioning number. It didn't give the sound tones like da da da, like this is a non-functioning number. It didn't do that. It didn't, nobody answered. It was completely silent. You would call this number, the number that the voice message was sent from. If you called it back, it was completely silent. And I couldn't like we tried it, and it's like it's like it came straight from the stillness. And I kept asking her like, can you tell me, like, say the name again? What is it? Because maybe it's something else. And then over time, which we kept saying Saint Clair, Saint Clair, then we started, I was like, oh, maybe it says Saint Clair, Saint Clair. And I was like, I don't know that saint. My upbringing is Catholic, and this sharing of this story isn't meant to be about any religion per se, but actually just sharing a message straight from spirit. So I looked up, and it looked up Saint Clair and said Saint Clair of Assisi. And my dad has a statue of Saint Francis of Assisi, who worked with animals and everything. He has that in his garden. And so there was so many layers of meaning to this. And I was like, oh my gosh, she worked with Saint Francis of Assisi, and Saint Clair of Assisi. It was amazing because it said it was a patron saint of media and TV and like basically screens and things, um, because eh, uh, there was like a story of her. She had become ill, and she had wanted to attend the mass, the service, and she couldn't. And so she asked to be able to attend. And then this vision of the service came on her wall. This is like hundreds of years ago. So that's why she became the patron saint of screens, of television, of things, um, of media like that. And so that was, this is Saint Clair. I just want to tell you that I'm proud of you, the work that you're doing. And I was doing more work with media and getting the message out. And so, like, for me, this was this miraculous message from my dad into the physical, which still blows my mind. Like, we still can't believe that we know it, but we just have to know it for ourselves because you tell the story to anyone else and it's like, "Really? How did that happen?" And it's a non-working number and we don't even know. But um anyway, I was in New Orleans this last weekend and we were walking around, me and my daughter, one of my daughters, and we were really tired, but it happened when the last shop that we walked into was a shop for of art with these local artisans, and so I would just wandered in, not knowing, what we were gonna be looking at, just, having fun wandering through the city, and of course, like, New Orleans, like so many different areas of the world, has gone through so much, recently, but, I just noticed, I was like, something caught my eye, and it was this art piece, and it was on Saint Francis of Assisi, and my first thought was like, "Oh, that's so nice, I'll get that for my mom," because my dad has Saint Francis in his garden, that will mean something to her. And then I started to think, I was like, "Oh, I got that message, like, several years ago, a phone call that said from Santa Clare." And I was like, "Oh, yeah." I was trying to remember the name and then, like, very quickly, my eyes went to it's like something was, like, directing me where to look. Because as soon as I looked from St. Francis, like, within, like, moments, I looked over and I was like, I saw this art piece, and it was for Saint Clare, which is a lesser known saint, so it wasn't something that you would commonly see. And, and then I talked to the manager of the shop, and I told shared her the story of this phone call that we received and why this was so meaningful to me. It's really not so much like the religious aspect, but this messages from spirit, which transcend like any religion of something that is meaningful for me, and this support and confirmation that I'm getting from the divine, the stillness, the creative forces that like, no matter what happens, like just keep going. And even though there are difficulties and challenges, like just keep going. And we're behind you and supporting you all the way. And that's really meaningful for me. And the store manager, she got goosebumps with me telling the story. And she said, she's like, what's strange is like we just got those pieces for of St. Clair yesterday. She's like, I really think it was meant for you. And she showed me like a much bigger piece of St. Clair as well. So I'm going to share this one art piece, and this is St. Clair of Assisi. And written around it are all these things of what she stands for. And what's interesting here, it's like there's so many dimensions of meaning when you get these signs from spirit. So it says like television, writers. So, doing this video podcast and writers and the book I just wrote. But it also says crocheters, my grandmother, that was like one of the main things that she did. She crocheted these fabulous pieces. And so that's why I wanted to share that with you today, because you never know when these signs of spirit are going to come through. And it doesn't, sometimes they're more elusive, and sometimes there are those quiet messages that seem like your thoughts but seem like quieter or different than your thoughts that come through. And one of the kids in the family and the extended family had described it like that, and it's so true. That's how it is, how we teach it in our courses and our classes with School of Stillness and the Dig On series, of like tuning into your intuition and hearing like guidance from beyond. And she described it so similarly to the way that I'll describe it in our courses, that if you just relax completely and quiet your thoughts so much, then you might get this thought, but that doesn't sound like your thought. It sounds different than your voice, but it's so loving and supportive still. And so this is how one of the kids in the extended family like communicates with my dad even after he's crossed over, and she's been trying to teach the adults too. And this is what we do in our classes with School of Stillness and the Dig On series and the MultiDimensional MD podcast and in all of my work. And so I thought that I don't know what any of this means to all of you, but to get a physical message or an audio message straight from the stillness and land in your voicemail is pretty miraculous. And I'm not telling you this because this is unusual or even unique to me, but I'm telling you this because these are things that happen to everybody. And the more you communicate, are more open to it, and just say, just ask. And every day I'm like, show me, please, show me, help give me direction as to what I'm supposed to think, say, do. And these are the kinds of things that happen when you just keep asking. So I hope that this helps you somehow. And if you have your own stories, I would love to hear them. Please, send me a message or leave it in the comments, um, and share this episode with anyone that you feel like could benefit from it. And please share the podcast. I'm working on getting it distributed to the regular audio podcasting platforms like Spotify and iTunes. It's mainly been on YouTube for these years, but I've had requests to share it in other ways as well, so that we can get the message out. So thank you so much for listening. If you made it this far, I love you all a lot, and I'm wishing you so much joy and happiness and love and peace in your lives, and heaps of blessings and miracles every day. Never underestimate even the smallest thing in your day that can help bring more light into your life and others. So lots of love to you. I will see you next time on Wednesday, whenever I get to it, another episode of the MultiDimensional MD. It's Dr. Arlene Diamco. See you next time. Bye.